The mission of Latinos in Virginia is to provide education, support, and advocacy for individuals that speak Spanish or are limited English proficiency from the Latino community. Things that we want to help them achieve is to become healthy, happy, and self-sufficient after being victimized. So the Latinos in Virginia was born in 2008 because a group of members of the Latino community start to be worried about what was happening with our community and the needs that our community has. And there were a lot of people doing certain services, but they were all disconnected, and many people from the community didn't knew that those services exist. So as a grassroots organization, we were founded in 2008, but it wasn't until 2018 where we start to establish the organization as a 501c3 organization. And then before that, we were just helping people from the Latino community. Not paying too much attention was the reason they were in need, but just to try to help them through the process or to get the resources that they need. But in 2018, we started to think who we were helping, and the majority of people that we were helping were people that were affected by violence somehow. Some people have some victimizations at the moment that encounter services from us, but other people came with the trauma from their countries, and many of them they were fleeing violence from their country and coming to establish to the United States. So in 2018, we decided to focus our services on victims of violence and address the problems that were in the system to provide these services. And we identified three main problems. And those were, the first, that there were not too many service providers that can speak and understand the culture of the Latino community. So there were not too many service providers for victims. The other one was that the Latino community, Hispanic community didn't trust in those organizations providing services. And the other reason, the other problem that this community faced was that there were not too many information in Spanish to really educate them was how the system worked and where were the services available. So we designed our programs, try to address all these three problems. And that is the way that Latinos in Virginia programs start. And we have 4 programs now that address those problems. And the first one is the services for victims or people affected by violence, where we provide services that include information, referrals, counseling, peer counseling, and also clinical counseling for people that are need help with mental health services. We provide case management, court companion. We provide a shelter placement. We do not have a shelter, but we help people navigate the system so they can get safety in the shelters already established. We help them to find housing and also help them with emergency assistance when the funds are available. So in this, providing this program, what we are trying to do is that people that are in need of services don't hear, I'm sorry, I don't speak in Spanish, I can't help you. When somebody access to our services, we can guarantee that all the services are provided by bilingual, bicultural, and trained victim advocates. And all of our staff has these skills, which makes easier the process to get the help that they need. So we operate in 2 levels. One is the statewide level, that are the services provided by our 24/7 hotline. And the other one is the greater Richmond area, where we can provide face-to-face service. Our third program is our second program is what we call defensores comunitarios, that is the community advocates, in which we go to our Latino community and talk to them about what are the resources, how a victim of violence can get help. what to do if somebody is close to be victim of violence, how to respond to a child telling you that they were victims of violence. So our community can be better informed. And in this way, send people from the community back to the community, and they can spread the word about the services that we provide. And the other program that we provide is the technical assistance and education, in which what we want to do is try to help the Spanish. We want to help English speaker service providers to provide better services for the Latino community. So be this tool and help them to provide this wonderful services that mainstream organizations provide. But sometimes the problem is that they can people from the Spanish-speaking community can access to them because the language barrier and also cultural barriers. So we are there to build bridges and be able to connect the Latino community with other service providers. And in this way to create a coordinated, affordable response system to support these victims. When the COVID pandemic started last year, we noticed a change in the nature of the calls that we were receiving. Many people from our community were calling because they need help with basic needs. As the Latino community has been disproportionately impacted by the pandemic, we respond to the needs, creating new programs and also expanding the programs that we had. Before our helpline, our 24/7, our helpline, because it was a helpline before, um, only help people that was affected by violence. Victims of violence called our helpline and they received the resources. But when the pandemic started, we were receiving calls from members of our community that they want to know what was going on because there were a lot of information in English, but there were not a lot of information in Spanish. And one thing that started happening is that people received half information, part of information, and they were creating confusion. And they were not well informed about what was happening in schools, what they can do, what they can. So they were calling La Línea de Ayuda, because the helpline, to receive all the information. And our advocates, we were responding calls, and we saw an increase in numbers. We were super busy the first month of the pandemic, just providing information about what was happening. And then people, even with victims, we noticed this switch. They were more interested in secure their physical space, like for example, their house, to make sure that they have their bills paid, the electricity was going to be there, the heating were going to be there, and more than their concern about their safety because they were living with an abuser or they were they I think that they were switching from right now I need to be safe in the place that I am and stay here than try to get counseling to leave this abusive relationship. So that is something that probably some people start calling more for financial assistance, and we open our financial assistance services for people affected by the pandemic. That is something that we were providing through the whole year, and even now we are still providing some financial assistance. Then the other things that we have to change was, well, we were now providing services face to face, and that was a cultural switch because as a Latinos, we are a culture that we are used to see, smell. I need to see you all face to face, and we are very sensitive people. So we need to make sure that that we educate our people about how to utilize those new virtual tools, and also create this space so they also feel comfortable with the work we're missing. I mean, we were now on screens and we were not used to that thing. But little by little, I think that the community has been adapting, and that opened opportunities to us too, because in the beginning we were providing for example, support groups only for the people that were in the greater Richmond area that can access to our office. But once we start to provide support groups for virtually, for victims of violence. We were serving people in the whole state that many places where the Hispanic community is smaller, they were able to connect with us and receive those services that before they were not able to do that. So uh, that was something that we see an increase in numbers. Also, people that were served outside of the greater Richmond area. Then another opportunity that was created was the Facebook Live, because we were able to create a series of programs that we call Conversando entre Amigos, chatting among friends. And what we did there was invite people from different fields that have some that do some work with victims, and they were educating the community about protecting order. They were talking about how the police respond. They were talking about how to get a child support, custody visitation of the kids, housing options. And that was very success because the people can just be in their houses and be receiving the information in half an hour. And we were able also to connect with people because they were making questions live. And that was interesting to see how the people from our community start to engage with, for example, the police, because they feel safe. They were in the house and they are seeing the police, and they were making questions about, how the police respond to this, why is happening this, and that was very, very good tool that we were able to utilize through the pandemic. The counseling stations also were moved telephones, and we have also we have a good success with those services too, because I mean the victims can access transportation that before the pandemic was a very big problem for our community, because not everybody can access to a license, to a driver license or a car in our community before the pandemic. Now they can access the services by phone, and that was something that we didn't thought even provide that before. Right? So that was very interesting to see how all the team and all the community adapt to these new services. Now going back, we think that we are going to keep those options, because I think that might open the doors to people that have some barriers to come to our office to receive services.